Hello, my name is Cynthia Mathieu. I am a professor and psychologist, and in this week's video, I will talk about panic disorder and panic attacks. First off, if you've ever had a panic attack, you need to know that you're not alone. About 1 in 3 Canadians will have a panic attack in any given year. And that doesn't mean that all of these people have a panic disorder, because only about 1 to 2% of Canadians will present panic disorder. So what's the difference between the two? Let's start with panic attacks. If you have ever had one, you know that it is highly uncomfortable and very scary to have. Some of the symptoms can be sweating, increased heart rate, feeling dizzy, tingling in the hands or fingers. Some people might experience nausea, feeling of choking, having a hard time breathing, chest pain, discomfort. Those are all symptoms that you can have. And also, panic attacks are often accompanied with thoughts of or fear of dying or fear of going crazy. You can also have chills or hot flashes. So those are most of the symptoms that people have. You might have had a panic attack where you did not have all of those symptoms. Everybody is different, but those are the common symptoms that people have. Panic attacks usually happen very abruptly, without any warning. Sometimes they are triggered by intense stressors in our lives. They usually happen very quickly. It's in a matter of seconds, and they last for about 15, I would say 10 to 15 minutes. Some of the symptoms may remain for a longer period of time, and usually people feel exhausted after having a panic attack, and for good reason. The difference between panic attacks and panic disorders. So the panic disorder is when you have more than one panic attack, so recurring panic attacks, and that these create worries. They are followed by really concern about having another attack, and a change in general functioning and well-being, because of that constant fear of having other attacks. And I guess for a lot of people, one of the ways to cope with panic attacks is to start avoiding certain places. So oftentimes with a panic disorder, you will have people who will also have agoraphobia. And agoraphobia is the fear of being in a situation where you might have a panic attack, or where you might have increased anxiety without being able to get help. So these situations could be or also fear of being embarrassed in a public setting where you would have a panic attack. So that could include public transportation, open spaces, enclosed spaces like shops, or movie theater, being in a crowd, or even just being outside of your home. What do you do if you do have panic attacks, and frequent ones? The good news is that therapy really does help. In psychology, cognitive behavior therapy has proven to be very effective in treating panic attacks and panic disorders with or without agoraphobia. And I really encourage you to seek help as soon as possible. And what would it look like, the treatment of panic attacks or panic disorders? Really, part of it is teaching the patient to feel comfortable in experiencing some of the physical symptoms. Sometimes we will induce panic attacks in therapy, not at the beginning, but when the patient is ready, when the patient has the tools and in a safe environment to help the patient cope with the different symptoms. We will also gradually expose the patient to anxious situations or situations that make them anxious. For example, we'll ask them to rate different situations or scenarios from the easiest for them to deal with to the toughest one or the most anxiety provoking one, and then gradually we will expose the patient to those situations and eventually help the patient try to stop avoiding, for instance, situations where they are in enclosed spaces. Might be the worst ones for them. So we'll start with smaller situations and with that one. There are a number of books that can also help you. I will have a list in the comment section so that you can have a read if you want to. What's very important is to know that there is treatment out there. There is hope. You're not alone. A lot of people will have panic attacks and panic disorders and a panic disorder throughout their lives. But it is treatable. So don't make sure that you don't stay alone with that. Make sure that you talk to people about it, that you get help as soon as possible, so that this problem can be dealt with effectively. So I hope you've enjoyed this video. Have a great week. I'll see you next time. Bye-bye.